Great question. Right now, is it Randy? Randy, the bill is changing constantly. As you can see from the presentation, it's changed a lot from when it was first introduced in a draft form, changed throughout the amendment process in the House. We don't even know what the Senate Finance Committee is going to present us with. That is going to be one thing we're going to have to deal with if we're going to pass any health care reform bill. When we go back in September, we're going to actually have the vote on the House floor. There will be a lot of debate on the floor. There will be additional amendments offered by people who didn't serve on these three committees. So yes, there will still be a lot of changes that take place. If you want to have input, as I said earlier, contact my Davenport office, contact my staff in DC. We're constantly taking information and trying to improve the bill.
Great, thank you. We have a question right here in the front. Sir, if you stand up and your name, please.
My name is Mike Carney. I'm from Clinton. My question has to do with the references made here to wellness programs and preventative health care. I think most people acknowledge the fact that one of the biggest problems we have in health care in the country is that people make poor lifestyle choices. I've worked for organizations that have wellness programs, and in my opinion, they've been more lip service than effective. And I haven't seen any specificity as how you might incentivize people to make healthy lifestyle choices so they don't develop diabetes and other things that are really a product of lifestyle choices in many cases.
Great question, Mike, and it goes exactly to the point I was talking about earlier with 70% of our healthcare dollars going to treatment of chronic diseases. And one of the problems is you can't just take this in isolation and say, how are doctors going to solve this problem? Or how are hospitals going to solve this problem? This is a problem that goes into our schools, it goes into our homes, it goes into our workplaces, and there's a lot of really innovative things in the bill. It's a very lengthy bill, and I was trying to give a short overview. But let me give you some ideas. One of the problems we've had in the past is that healthcare providers have not been provided reimbursement for dealing with wellness and prevention issues. This changes by requiring the Secretary to come up with a national strategy to address wellness and prevention and address the problem of chronic disease management. But one of the things that we know is that patients get much better outcomes when they have a personal relationship with a primary care provider, whether that's a physician, a nurse practitioner, a physician assistant in a rural community, but somebody they know and trust that they come into who helps manage and coordinate their care even when they're referred to as specialists. And so one of the major focuses of this bill is to try to correct and reverse a trend that's been happening. When it used to be 20 years ago, about 2/3 of the doctors in this country were primary care providers. Now it's exactly the opposite. Half of the primary care residency slots in this country go unfilled. And one of the things we know is that when you're dealing with someone who has a bad lifestyle choice that's causing them to be obese or not manage their diabetes, it's one thing to offer them a sheet of paper and say, stop doing it. It's another to give them a chance to sit down one-on-one with the healthcare provider they trust who can give them a support network to do the right thing. And that's why there's a lot of innovative care models in here that aren't just fee-for-service reimbursement. Like the Accountable Care Organization gives physicians and primary care providers in a network in their community working with other healthcare providers to try to make sure they're getting the best possible outcomes by monitoring what's going on in their patient's life and giving more incentives for that personal touch where you're seeing patients for longer than 2 minutes. And we also know that when you look at what's happening in our schools right now, one of the reasons we've got real problems with runaway juvenile obesity is because we've also gutted funding for our physical education programs and our health programs in our schools. And so what we need to be doing is teaching kids lifestyle physical education that they can use their entire lives, teaching them better habits on eating so that they're not getting junk food every day, and educating their parents about the dangers of that, because all of that affects chronic disease. And the numbers on juvenile obesity in this country are staggering. And everybody in this room is going to be footing that bill for those kids as more and more of them develop chronic disease that require management. The more aggressive we get